One of the things that we've been struggling with as a nation is increasing our health outcomes, changing them, making them better. And when you are able to help frontline workers who live and work in those communities to be able to then grow to become the professionals who are giving the care, it's one of the only ways that I know that it's going to be truly able to affect the change that we're looking for in health outcomes.
Because it's one thing to put people in the jobs, but a career pathing is a much different process, and I think a more sustainable process for creating jobs for people.
So this work helps those individuals to get a leg up and in many cases overcome some of the obstacles that have stood in their way.
When they feel that an organization supports them, is supportive of them, and they are engaged, they become better employees and they give back to the organization.
It helps to reduce some of our recruitment costs, and it just improves overall productivity.
Also, it's created a culture of opportunity for employees where employees understand that if they come in one job, they have the opportunity to continue to build their skills and move to another job.
Statistically, we have shown that individuals who are invested in not only stay with the organization longer, but give back tenfold over the ability and the investment that you make in them.
And most importantly, we hope it really results in great patient care.
The best way to help individual people is by organizing employers who are in a common field or sector or common industry to get them to speak with one voice as much as possible about what they're looking for, and then to build pathways from that desire back to those job seekers you're trying to help.
And we actually insisted that it be employer-driven and that the providers of training listened to the employers, and the employers said, okay, these are the essential skills we absolutely have to have. We developed the technical training program around the jobs that the hospitals identified that they were going to be hiring for in the next 12 months.
And we really are the conduit to help connect that job seeker, both a student that's completing training as well as the individual in the community, to connect with the employer and the opportunities.
We've earned the trust of those employers by demonstrating we can produce what they're asking for. The more you do that, the more they want to work with you to work on more of those pipelines, get more people involved.
The value to the job seekers is when they know there's an employer connected to the Career Center, to the training, it's so much more valuable to them.
It really works because we have built the relationships and the connections between the training providers and the employers.
We are constantly seeking out new partners to ensure that we're able to meet the needs of our workforce.
And it allows us to better communicate with other member hospitals where normally there may be some silos in terms of communication and sharing of best practices.
We have become more collaborative because we sit together and we have a common cause.
We really do like to leverage people that have those best practices and that provide us with current information.
If in fact you got into this thing we call healthcare, to see people improve and people heal and to people become more in control of their healthcare personally, the best way that you can effectuate that mission, that calling, is to invest in the people who are actually going to be doing it on a daily basis.
I feel like there's no end and no limit to what can be done when we give frontline workers an opportunity.